members. I hope everyone's. Thank you, Rhonda. I'm trying to find my camera. Oh my goodness. Okay. Did that work?
Yes.
I'm having technical difficulties today, so sorry about that. So Susan, I know you and I haven't talked, and I hadn't talked to Gretchen. It's just been a wild week. So I've put the agenda up. So basically what I'd like to do today is just talk about the 2022
Is that everybody who's supposed to
committee.
be at the meeting?
We have some echo.
I think everybody's here except for Kimberly, and she'll be on in just a few minutes, but she said to go ahead and get started without her.
Okay, well, my name is Ruth Hall, and I am a foster parent for Coweta County, and I'd like everybody else to introduce themselves, please.
Looks like that.
Oh, guys, I'm gonna try to mute everybody. Hang on one second.
Yeah.
I'm Jeffrey Brown. I'm the regional.
I think somebody's multitasking.
Yeah. It's the sign of the times.
Okay, I thought, well, am I in the right meeting?
Hey, get out the minute.
Okay, so back to our legislative committee meeting. So what I'd like to do for the agenda is just discuss the 2022 legislative committee goals and priorities. We presented those this morning to our board meeting, and I didn't hear any objections. So we are going forward with that. So I'm going to go over those in just a minute, and then Susan's going to help us with bringing us up to speed on how the kickoff session went and the state of the state address. I know she's already written up a great report on that, but if she wants to just kind of go over anything she wants to share that and talk about the road show that's coming to Floyd County that we just found out about, and the new legislation that's been introduced. So they're off and running. We've already got several bills that we're monitoring. So for our goals and priority, we all know that staff retention has been a huge thing that we're trying to help overcome these issues that keep us from losing staff and then keeping them, happy while they're here. So we have two major goals that we're looking at for 2022, and I'll send this out to all the legislative committees. I'll send the goals and priority and all the other documents so that you can review at your leisure. But the two main goals we have are, the first one is to advocate for higher pay for employees, bringing them to the market rate standard. Low compensation rates have created a deficit in staff numbers despite continuous hiring and recruitment, because long-term employees are leaving DHS for higher paying jobs with less responsibility. And vacant positions are posted multiple times due to no applicants or applicants declining the job due to the salary. And then the second goal is to advocate for manageable and equitable workloads. The turnover rate and inability to attract new talent has resulted in long-standing unfilled vacant positions. Consequently, the remaining staff must absorb the work and often cannot provide optimal service and outcomes. Historical data demonstrates when caseloads exceed the established and nationally recognized standards, the following occurs. The efficiency, effectiveness, and stewardship of taxpayer-funded programs suffer for all major functions in Georgia's Department of Human Services, divisions, and offices. Excuse me. The safety and well-being of families and children are diminished because the staff does not have the adequate time or resources to address the basic preventive needs of family, such as food and medical assistance. And then our priority that goes hand in hand with these goals are to advance the protocols, policies, and practices that ensure staff are safe and have resources and support needed to do their jobs. The Georgia Professional Human Services Association, GPHSA, is a professional association comprised of over 2,000 persons who work in or are affiliated with Georgia's Department of Human Resources, or DHS for short. We are professional staff who support the agency's work and work together to improve systems that support safety for children and vulnerable adults, strengthen families, and assure that Georgia has an effective and efficient system of service delivery that strengthens our state. Our legislative goals and priorities guide our work with the Georgia General Assembly. Failure to assure adequate compensation and achieve reasonable workloads ultimately is a waste of money and compromises the integrity of administrating benefit programs that totals billions of dollars. Furthermore, it puts vulnerable individuals at risk and undermines the well-being of families and children. Recent salary benchmarking indicates the pay for human services professionals in Georgia is amongst the lowest in the southeastern United States, with the turnover rate being amongst the highest. Therefore, public interest is best served by assuring reasonable workloads and competitive salaries that promote retention. There is no more valuable resource than the people who do the work. Therefore, we must advocate for them so they can advocate for others. Together, a difference. So those are our goals and priorities for our legislative committee. And in addition to those, we're also going to be focusing on making sure everyone knows how to find out who their state representatives are in their counties, how to advocate, the do's and don'ts. We have some talking points for that, and like a little advocacy elevator speech kind of thing, because you don't have a lot of time when you're talking to legislators. So you need to be quick, but to the point, but it still needs to be impactful and beneficial to further us. So I'll send all that out, but we're going to be focused on how you can do the advocation. And with it coming to Floyd County, the road show, I'm in Rome, Floyd County, so I'm going to be sure that I'm at the road show, and hopefully we can get our legislators. I think Katie Dempsey's one. And so we want to have presence there. So, all right, any questions on the goals and priorities? Is everybody okay with those? Yes? No, maybe?
Yes.
Yes.
Yes, we're okay.
All right, good deal. All right, Miss Susan, are you ready? Okay.
Yes, I was
Take it
printing
away.
something, just so I'd have it in front of me, the state of the state. I forgot to print that out because, you know, that was the first week of the session, and stuff has happened since then. So, but I have it here in front of me. I just wanted to touch on that briefly. You had mentioned it, and I thought, oh, I should probably touch on that. So the highlights of course, the shining highlight is the $5,000 pay increase in the amended and in the budget that starts July 1st. So I'm not going to assume everyone knows what this means, but if I'm insulting your intelligence and you absolutely know what this means, just bear with me for a second. So basically what Governor Kemp proposed was a cost of living adjustment that would be factored in, a $5,000 one that will be factored in prior to July 1st of this year. And that's in the amended budget, the budget that ends June 30th. And then an ongoing $5,000 increase. So I think everybody's kind of clear on that. What I was told, and I told the board this earlier, I've not seen this officially, but I asked how will that be distributed, and I was told that the amount that would equal around $3,470 would come out in a lump sum. Let's see here. Around $3,300 would come out in a lump sum sometime in March. And then the increase you would see in starting July 1st would go ahead, accounting could go ahead and increase everyone's paycheck by $416.66 per month. So if you divide that by 2, it's $208.80 or so. Then they would go ahead and increase the pay so that there would not be any difference in the pay you get after you get the lump sum as before. So if you get the lump sum in March, the end of March, then your April 15th, April 30th, May 15th, May 30th, June 30th, June 15th would include some level of an increase. It's probably more than likely you might get that lump sum in April, and they spread out the remainder of the $5,000 over the May and June paychecks. But that is how I've been told it will be done, is there would be some level of a lump sum, and then the increase of the $416.66 they would only have to do that once. They wouldn't have to do it one time this year and then do it again effective July 1st. Who knows? But that's what I was told. Also, during the board meeting, we had the question come up of, and this has been asked to me and I didn't know the answer, so this was good information for me, that what about people who are at their income ceiling? And Denise, who was privy to the original proposal, said it's considered a supplement, so it would not push you over. You would be able to get that amount. Now, I don't know if that means just for the amended budget or if it means ongoing as it's annualized, you would continue the same amount. So when I asked, I was told some of those things have not been figured out yet, but this is what we're hearing. If anybody on here has any like verified information and wants to clean any of that up, I welcome that, because I don't want to be putting out speculation, but I just want to tell you what I'm hearing.
Susan,
Yes.
this is Kelly. I just wanted, there has been a lot of discussion around this. And we've been told from leadership that HR is in the process of trying to create some talking points to hopefully help all of staff kind of understand how this is going to roll out. So we are anxiously awaiting that, because you're exactly right. Just about there's certain camps that think certain things. So
Yeah.
hopefully that will be coming out, rolling out. So staff will really get a grasp of all the points that were in the budget.
So just know this, I'm just telling you what I've heard. It's hearsay and that it has to be decided. And so I'd rather us be able to share and not worry about, just know that it's not for sure. And please don't, get me in any trouble. Anybody got anything else?
I was just going to say that we are sharing basically that all it is right now is a proposal, and that we will iron it out, and just basically trying to encourage staff that our leadership and our governor supports this, and our commissioner, and so the kinks will come and be ironed out as they come, but knowing that whether it's passed or not, at least our leadership supports this. So that's the message we're trying to send.
Yes, there seems to be a tremendous amount of support for this. So I'm very hopeful, but the first indicator of what will happen will be when they approve the amended budget, which typically happens in mid-February. And that's the first step that has to occur. And then if the amended budget is approved, then HR can really get to work. I mean, it wouldn't even make sense to put together a whole lot of information right now because the budget hasn't even been approved. And then the budget that starts July 1st, most of the years I'm aware of, or that I have been paying attention, that budget is approved if not the very last day, the next to the very last day. So you may only have partial information until, I think the session is scheduled to end on April the 4th. And so we may just be in a holding pattern. The good news is lots of support. This is a historic, I don't ever remember anything like this occurring before. So just be grateful. We collected a lot of information, anecdotal stories on how the low salary was impacting our staff, and we have shared that widely. So far, I've not heard that anybody has really needed any hard-hitting information to try to convince someone to approve this. It just seems to be something that there's a lot of support around. And so we're available. We have all of our information collected, and we've sent it out in case we need to offer any, stronger argument toward it, but hopefully not. Hopefully that is a done deal. So that was the big thing about the state of the state. There was an increase for a 10% rate increase for caregivers, foster parents, child caring institutions, CCIs and CPAs. There's the recommendation to expand Medicaid to cover 12 months for new mothers. That legislation, actually, I signed out. Originally, I was just going to watch it because it's been lingering around, but I actually assigned it to Tori, I think yesterday, to, I just think it's something I would like to get Tori's input on it. I think it's something that OFI needs to be aware of. And so it's Senate Bill 338. So that legislation has already been presented and is in the process of being reviewed. And then there was many other things that were included for teachers and for the university and education system, the technical college, law enforcement, of course, mental health. This is mental health's year. So a lot of the legislation we see has to do with mental health. Danny has the big legislation that was introduced that people are referring to as mental health parity. And we can hopefully get his take on that next time, because it hasn't been long. It's a huge piece of legislation.
Yeah, I appreciate you sending that.
Yeah. Hey, I did skip you this next time though. Jonathan's already gotten a second piece.
But
And
that
as
is,
well.
I've read it, went over it, but I'm going back over it with a fine tooth comb. There's nothing like that stands out. I just have, I guess, more questions than answers, but I don't feel like it's impacting DFAC. So I may be wrong, but I'm gonna keep digging. You will have it by Friday. I think that's for the deadline you gave me.
And if you need longer, it's okay. And Danny brings up a good point. Typically, we assign out legislation that just directly affects our work, but this legislation was getting so much attention. I felt like we should at least share what we saw in it and if we felt like it had any bearing on our work, which is why I signed it. But it is a big piece of legislation. Another thing that was done this year, so we're going to move on from the State of the State address. Those were the highlights. And I have a summary document that I can share with anybody if you didn't happen to get it. We sent it out, but I know sometimes stuff that goes out en masse can go to your junk folder. Something else that was done this year, maybe it's been done every year and I just have not known about it, but they produced a calendar that laid out every day of the session, when they would be in session and when they would not. They're the 40 days. And they've always sort of done a calendar, but this is very specific and is super helpful. And I'm happy to share it with you, but basically it lets me know that we had day 9 on February 1st. We had day 10 today. We have day 11 tomorrow. And then day 12 is on the 7th. So and day 13 is on Tuesday, the 8th. Then we skip a day, and then we have day 14. So it shows all of the days that they're skipping. So you would know, and I know, I don't have to go in and dig around and look for legislation, except for the day after the session has convened. Crossover day is slated for March 15th. So if legislation has to have been introduced between now and then and have made it to the point of vote, or it will die. Now, we have some legislation from last year that was sort of tabled that we are watching. I'll go ahead and go into that. The things that I am continuing to monitor are House Bill 272, which was termed the Raise the Age Bill. And it basically raised the age of a child who will be, if they have an offense, managed in juvenile court, not a heinous offense. This would be just a misdemeanor or lower level offenses, to be their case be heard in juvenile court up to age 18 instead of ending at age 17. Lots of discussion about the cost of implementing this, but it was recommitted on January 10th. The bill was assigned last year. We have the feedback and the recommendation on that from last year. I'm just continuing to monitor it to see what happens with it. The other two bills that I'm just keeping an eye on are House Bill 323 and House Bill 324. Both of these were introduced and kind of did nothing after they went through second readers on February 9th last year, but they would impact the termination, expediting and prioritizing the termination of parental rights for certain cases, to revise the definitions that could be used and the circumstances that can be used when reasonable efforts are not required by DFACS. And so that's 323. And 324, it relates to which parties may intervene and participate in the dependency proceedings under certain circumstances. Again, these did not go anywhere, but I have heard a little bit of talk about them. So I just want to keep an eye on them to make sure they're not recommitted. So that's the legislation I'm specifically tracking right now, as well as just some other things that I'm watching on the periphery. I included a few of those bills in my legislative report in January. For January, I get a legislative report from the Retirement Association, and I liked their format. So I adopted their format and have our information in that same format. And then at the back end of it, there are a couple of pieces of legislation that are being tracked by the Retirement Association that I thought might be interesting to you. The ones that would particularly be interesting to you, as there are a couple of bills that provide for Medicaid expansion to uninsured individuals in certain areas, specifically counties where there are less there are very few exchange plan options. And so there's this bigger conversation about Georgia participating in the full expansion of Medicaid versus pieces of it. This is not the full expansion. This is, again, a piece of it, just like the Patients' Rights Act provided Medicaid for persons who work. And while there was some back and forth around the work piece of it, I believe there's some positive movement into allowing that to go into effect. I do not have the specifics of that right now. I know they're still working out some of the details, but the trend is that we are seeing Medicaid expand in different avenues rather than the full-on expansion. The postpartum Medicaid is one thing. This allowing for expansion into areas that have less than 3 exchange plan options. And then there's another bill, this is House Bill 214, that would allow individuals to buy into Medicaid as a coverage option. It would provide the same coverage as to ordinary Medicaid patients, should be no less extensive than what is in the exchange options and the Affordable Care Act. And it would not have any impact on the eligibility for people who receive Medicaid and do not have to pay for it because of their income status. I'll be interested to see what happens with that, but it's a trend I thought was worth mentioning as this Medicaid expansion conversation continues on. That is pretty much what I have. Does anybody have any questions? All right. And I sent this report to Gretchen and Vicki last night. We'll get it out to you and to all members. It's just a list of the legislation that has either been assigned or that I'm tracking or that I felt was of interest that GSRA was tracking. So we'll get this out to all members and specifically send it to you so that you will be sure to get it and it won't get lost. So it'll probably come to you twice.
Thank you, Susan. And I'm also in the process of building the master spreadsheet like we had last year, where it tells who sponsored the bill, what the bill number is, the link to it, what committees it was assigned to, the first reader summary, where it is in the process, and who was assigned to it as far as our committee to review and our recommendation as to monitor, support, whatever that is. So I'm in the process of building that. So I should have it complete the next couple of days. It's kind of off on. It's been a crazy week, but so I'll have that ready too to send out. And I know that last year we talked about having it on the SharePoint site for people to go look at, like a link. I could send out a link and then they could go look for any updates. Would you want to do that as well? I think I put it out there last time and just sent the link out, and I don't know if it notifies everybody that there's been an update. I really don't know that part of it, but you could go check at any time and see what's going on between meetings. So next month, what we'll do is we'll go over the legislation that, you know, that we're watching, where it is, how it's going, and any new stuff that's come up. And that's right before, because our next meeting is March 2nd, the first Wednesday in the month at 1 p.m. So that's going to be before the crossover day. So anything can happen between now and then. And then in April, of course, we'll talk about the bills that just kind of died or that we don't follow in any new stuff. So that's going to be pretty much every meeting from here on, because the session is alive and going, and we all need to be up to speed where everything is in the process. So I appreciate all the content experts that stepped up to offer to do that. We really need you, and we appreciate you. Susan, I appreciate you taking the time to scout and find new legislation. And how's our lobby thing going? The lobbyist.
Well, I sent our information to Emily, who's sort of agreed to do pro bono. And then just as luck would have it, this is not lobbyist specific, but Carol Christopher, who's a huge fan of the GPHSA, the division, the employees. And of course, her husband is a legislator. And so she has been over at the Capitol a lot. And so we have been making time to talk about the GPHSA. We've talked once a week for the past couple of weeks, our priorities and what we are hoping for. And as a friend of GPHSA, she has the opportunity, because she goes to dinner with a lot of people and has lunch with a lot of people. She is just being a friend to GPHSA, and that is a lucky thing. And so I would say official lobbying, we're probably getting more out of Carol's conversations right now than anything. And that's just relationships and being in certain places and having the ability to speak freely. And so that is the beauty of networking and belonging to an organization that I think you really can reap the benefits of. So that doesn't directly answer, just go and find. We want to do a fundraiser to be able to afford an official relationship with someone who can be up there on our behalf or keep us informed. And we're kind of piecing it together right now because we're not paying for anything.
Okay, awesome.
And you did mention the road shows. So yeah, I literally, like at 4:55 yesterday, Commissioner Brose's admin person, Robin, called and we talked through some of the dates and whatnot, the first step is always trying to identify some dates that work for the commissioner. I'll just say that I'm not keeping anything from anybody. I just don't know exactly what it's going to look like. But we are going to partner, GPHSA is going to partner with the DHS to host 4 convenings this year that will be DHS in nature and not DFACS in nature. So we had 3 days of meetings that were focused on DFACS. That'll be scaled back to be, a day's worth of meetings. And one of them will definitely include youth in care because we have we're working on a workforce pathway for youth in care, and I believe have access to some grant monies that will help support that meeting because it's a great way to get input from youth. So one of the meetings will definitely be youth, and then we'll have to work with each area to, outside of a staff meeting, talk about the highlights we need to hit on the DFACS day, and then there will be a aging day and a child support day. The good news is that GPHSA will partner and we'll be able to get the name out to the other divisions and hopefully grow our membership a little bit. So the first one will be in April. The area right now that's slated is Rome, but we haven't reached out to anybody yet because we literally just got the information last night. But I can't tell what the opportunity is without putting that out there, but I don't want anybody to panic. There's plenty of time to plan. And as soon as I talk with aging and child support, then I'll be reaching out to OFI and child welfare we're not going to be region specific. It'll be location specific, because in DHS, the regions may not line up exactly. So Rome area is what we're saying, Gainesville area, Athens area, Valdosta area. Those are the proposed areas for this year.
Awesome. Okay. Well, we'll just wait and see how it shakes out, but it's exciting stuff. It gives us a huge opportunity. So we do have a question in the chat. Teresa is asking if we can change the time for next month's meeting because the statewide summit is scheduled for all the county directors from 1 to 3 on that. So I'm assuming, is that just a one-time deal, or is that every month they're going to have a statewide summit, or just once a year? If so, I mean, does anybody have an issue with maybe rolling the time back to around 11 on March the 2nd? Would that work for everybody? Everybody that is listening that wants to vote, please is there a way to raise your hand on this one on Zoom?
Yeah.
Okay, if you're okay with changing the time only for the March 2nd meeting, because we need to try to stay consistent because everybody will forget, to 11 a.m. on March the 2nd. If you're okay with that, please raise your hand so I know everybody's good with it. Okay. All right, Danny must be on a call.
No, I'm looking at my calendar.
Oh, sorry. All right, how about Kelly?
I can do 11 a.m.
All right, Miss Beasley, you okay with 11?
I am sorry. I'm still learning Zoom. I thought
I
I'd
know,
raise
me
my
too.
hand.
I'm like struggling over here. I'm like, no, where do I go? Because you get used to Teams, and then when you change it up, you're like, oh, I don't remember where that is, because it's different. Okay.
Yeah.
All right. So I'll send out a reminder, and I'll ask Miss Rhonda to change it on her calendar. Miss Rhonda, if you're listening, please move our legislative committee meeting for March the 2nd from 1 p.m. to 11 a.m. for that date only.
I will do it. And I'll
Thank
just send
you.
out a reminder. I guess I'll
Okay.
I'll send you the link.
Okay.
Well, I just have to edit the link, I think. Anyway, I'll
Okay.
figure it out, but you can remind me too.
Okay, and then I'll send out a reminder, and I'll also send out the goals and priorities document for everybody to see too. So, all right, so that clears that up. 11 a.m. March the 2nd. All right, anything else anybody needs to bring up, talk about, comments, suggestions, feedback, concerns? Everybody good? All hearts and mind clear? I'm looking, I don't see any more chat. Okay. All right. Well, I guess that is all we have. Appreciate every one of you that take time out of your busy day. I know we're all up to our eyeballs in alligators and trying to fight them off as quick as we can. So wait a minute, some chat came in. Always an important. Oh, thank you, Miss Beasley. That's sweet. All right. Well, thanks again. I hope you have a great rest of your week, and stay safe, stay good, and we'll see you at 11 a.m. on March the, well, those are, don't forget our training tomorrow. Almost forgot. 10 o'clock, isn't it? Gosh.
That's right.
Yes, 10 o'clock.
So please, 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 if at all possible, please join in, because they put a lot of time and effort into this. And I think it's going to be a very, very good educational training. So don't forget, tomorrow at 10. And anything else after that, Susan, or does that wrap up our winter training?
That that pretty much wraps up our winter training. I think that Social Services Committee is meeting at some point this afternoon, but if you're not on that committee, then that wraps up the day today. And the training tomorrow will be it will be an introduction, and then we hope to build on that with some workshops offered in spring and in the annual meeting, and maybe then a little bit more work if you wanted to get a certification. And be on the lookout for the newsletter that is, it's kind of quarterly. It's probably not quarterly, but anyway, there's some exciting changes coming to the, be on the lookout for an action that you'll need to take about some proposed changes to foundation funding, and then some other things that updates are going on that will be in the newsletter.
Cool. Excited. All right. Well, thanks again. And unless anybody has anything else, we will wrap this one up.
Bye, y'all.
All right. Thanks, everybody. Have a great afternoon.
Me too.
Bye.